I am really excited to be here today to talk with everyone about a brief overview of the data collection and genetic aspects of both hoof health and lameness. So, all right. To give you a brief idea of what I'll be covering, I'll begin with a quick introduction, much of which will just be a re-emphasis of what Gerard has just gone over. We're really going to drive these points home with you today. And then I will cover each of the components of the title of the presentation. So the data collection aspects and the genetic aspects, before bringing both of those things kind of together and discuss the future plans and possibilities going forward. So let's dive right in and I will get to that introduction. So my first question here is really, why lameness? So for many of you here today, that's a question for which you already probably have a plethora of responses. So here I've broken it out into two broad aspects. So from a production perspective, as well as from a societal perspective. So from a production perspective, we know that approximately 50% of cows will experience a hoof health event at some point, at least once throughout their productive life. So inevitably, that is going to increase the cost of production by increasing labor costs, decreasing production, decreasing fertility, increasing veterinary costs, and so on. Then a 2010 study did an estimate of the costs of 3 specific hoof lesions, sole ulcer, digital dermatitis, and foot rot, and that averaged approximately $150 per case due to the lost milk, treatment, and reduced fertility. So then switching gears and looking at the societal perspective, which Gerard laid out really nicely, so I will just cover really briefly. For one, lameness is a clearly visible health event. So as he pointed out, it's really easy for consumers and the general public to understand what's going on there, a hurt foot or leg. It's easy for them to kind of hone in on that. And then additionally, being able to reduce the number of hoof health events that require antibiotic treatment can also help us to potentially overall reduce the number of animals that require antibiotics. So now we have all these reasons why we would want to improve cows' resistance to lameness, of course. So then the next question is likely, well, why not lameness then? So CDCB released genetic evaluations for 6 other common health events in April 2018 for Holsteins, and then followed shortly later for Jerseys as well. But lameness was not included in those traits. And that's probably the most frequent question that I have received since then. Why do we not have an evaluation for lameness? And the biggest reason for this was because at the time of development and implementation, lameness records just had too much inconsistency and resulted in very low heritabilities of essentially 0. So one way to describe this is that the data were too noisy. Now, what exactly do I mean by noisy? Keeping in the realm of health traits, let's use an example of comparing displaced abomasum to lameness. So DAs could be considered a straightforward or black and white event, no Holstein pun intended there, but a cow either has a DA or she doesn't. It's very clear and easy to diagnose. There are also a relatively limited number of ways to refer to a displaced abomasum. Obviously, the most common is DA. You might also see RDA or LDA to indicate right or left side of displacement. But if you capture those, you're really gonna capture most of those displaced abomasum events that are occurring on the farm. So at the same time, there's usually only a single reason causing a DA, which is due to the anatomy. So now shifting gears, we'll look at lameness in that same light to try and understand why I would say that it is a noisy trait. So lameness is certainly not a simply defined trait. What I classify as lame may be quite different from what someone else classifies as lame. There's also many, many ways that people refer to lameness, especially in the herd software. So I've listed a few here, but there are many, many more. And we have to capture all of these ways in order to identify the incidences of lameness that are occurring. In addition to this, people may also use different definitions to mean different things. So I may use hoof to indicate a routine hoof trimming. My neighbor down the road may use hoof to indicate a hoof health event or a hoof problem. So lastly, lameness also is a result of many different causes. So there can be physical trauma, maybe one cow stepped on another one's hoof, or there can be infection or metabolic reasons for the cow becoming lame. So all of these characteristics kind of build on top of each other and make the data noisy, which results in the very low heritability when we look at just the general trait of lameness and why we didn't initially include it in the CDCB health evaluations. All right, so with that said, regarding the lameness data, let's move on into more information about data collection. So everyone here likely recognizes the importance of good data collection. After all, we can't address this problem without having good information. There are standards available for the recording of hoof health events already. At the international level, the first edition of the ICAR Claw Health Atlas was released in 2015, with a second revision released in January 2020. So the Claw Health Atlas describes the best practices for recording hoof health events to aid in the standardization and harmonization of data collection. And it provides a lot of details and visual examples for the lesions that are most frequently encountered. At the US level, the CDCB has the ability to receive hoof health data similarly to other health traits through Format 6 records. Format 6 includes a health event code for lameness as LAME, L-A-M-E, as well as a management code for locomotion as LOCO. At this broad level, however, without any additional information to go with it, it's difficult to identify true incidences of a hoof health event. So given this, and in light of the information in the ICAR Claw Health Atlas, the detail selection for the lameness events in Format 6 were expanded in 2017 in order to include that additional data. So at the first general level, the general cause of lameness can be reported, whether it be infectious, non-infectious and metabolic, or other. And then this update incorporated several of the hoof health events that are described in the ICAR Atlas, and I will show all of those on the next slide. So this table details all of the specific hoof health events that can be submitted to CDCB to incorporate the additional details for an incidence of lameness. So there are 15 different events included at the moment. Anything from digital dermatitis, foot rot, sole ulcer, physical trauma, and so on. So taking a look at the data currently available in the cooperator database, there are currently approximately 2 million just general lameness records for Holsteins. This includes both the incidences of lameness and the healthy contemporaries. And that has an average incidence across all the data of about 7%. And then similarly for Jerseys, there are approximately 400,000 general lameness records and healthy contemporaries with an average incidence across all that of about 4%. So the problem here is that none of these records include any detailed information tied to the reporting of lameness. And additionally, we talked about the locomotion code, but there are currently no records reporting the management code of locomotion, so we're not gaining any additional information through that either. So now we've touched on the data collection side of things, let's move on to the genetics. I'll highlight just a few snippets of studies that really tie in with the current project in utilizing on-farm records, as well as the hoof trimmer records. So previous research in the US that has utilized producer recorded data consistently identifies lameness as a trait with one of the lowest heritabilities among the health traits, typically in the range of 2 to 6% when using threshold models. And a large reason for this goes back again to the fact that these data tend to be relatively noisy. So then, is there a way to better define hoof health event data? A subsequent study in the US looked at this by incorporating hoof trimmer data with information on specific lesions, categorizing those as either infectious or non-infectious, with the more general on-farm recorded lameness, yes or no data. And in this case, higher heritabilities were estimated in the range of 7 to 14%. So that's good news. And if we jump across the border and look at research from Canada, they were also able to estimate higher heritabilities when using data describing specific hoof lesions. This project collected hoof tremor data for 8 specific lesions from hoof tremors that were specifically trained to collect data on 8 specific lesions as consistently as possible. Heritabilities were in the range of 6 to 19% in these cases. So with these data, LactaNet introduced a genetic evaluation for digital dermatitis in 2017, and then subsequently currently provides a hoof health index that incorporates 8 different hoof health lesions, which are listed on the right side of the slide. All right. Oh. Okay, there we go. So the main takeaways from the research, the very brief research that I've included here, re-emphasizes what we discussed in the previous slides. We really need data beyond just the binary yes or no if the cow is lame. Research has shown that the use of data on specific hoof lesions can increase the heritability, likely up to the range of 5 to 10%, and maybe with some traits even reaching a higher heritability. So we are better able to identify a genetic component of specific causes of lameness and better able to identify the animals with improved resistance to hoof health problems. So based on the research, this seems to be a promising way forward. Genetic improvement using data on specific hoof health events may be a feasible way to make permanent and cumulative improvement of dairy cow hoof health. All right, so now before wrapping up, I want to bring these 2 components back together, the data collection and the genetics, to identify the possibilities or opportunities of the current project. So as Gerard detailed, the current project aims to incorporate many important aspects for the improvement of dairy hoof health. From the genetic and data collection side of this, hoof trimmers will be trained to identify and record specific hoof lesions as consistently as possible. And we will create that integrated framework that Gerard talked about that connects the hoof trimmer records and other on-farm records and ensure that those data have a pipeline to flow to the CDCB. With these data available, a hoof health index can be developed that will allow for the selection of improved resistance to hoof health problems, while appropriately accounting for the correlations between hoof health events and their economic impact. So beyond that, going further, are there ways that we can make the data collection process more streamlined and consistent? Can we use technology like video or images to more objectively identify animals that may be experiencing a hoof health problem? We need to also ensure that the collection of these phenotypes is sustainable going forward. So using something like a video analytic platform to do this could increase the number of animals that can be phenotyped while also maintaining objectivity and not significantly increasing the amount of labor involved.